Good evening. I am Elizabeth Heiler, the CEO of the Commonwealth Institute, and tonight we present to all of you the second annual Extraordinary Women Advancing Healthcare Awards, also known as EWA.
And I'm Barry Blauvelt, CEO of Innovara and the other co-chair of the steering committee.
The EWA Awards each year recognize 10 outstanding extraordinary women across all healthcare sectors. And we specifically look at how these women collaborate, mentor, inspire, have an impact, and focus on diversity across their healthcare organizations and community.
These awards evolved out of the realization that we needed to recognize our emerging, amazing women leaders who were doing incredible work, not only impacting healthcare in Massachusetts, but also affecting the world. And we're here to celebrate them for that reason. We began in 2018 with our first meetings at the end of 2018, and then by 2020, we were able to celebrate our first 10 awardees. And it's great that we can continue to now build on that with this next group of 10 awardees.
The Commonwealth Institute is very pleased to bring you these awardees this evening. They are all, as we mentioned earlier, doing extraordinary things across healthcare and really making an impact. And that's what the Commonwealth Institute is all about. We have been as an organization, we've been around for almost 25 years, and TCI's mission is very clear. We're all about promoting, supporting, developing women leaders across all industry and across for-profit and nonprofit organizations. So our members range from CEOs down to the rising generation of women leaders. So again, we are thrilled to have the Extraordinary Women Awards as part of our portfolio of recognizing and honoring women. In particular, in the healthcare industry, there are so many women doing these extraordinary things or accomplishing a lot, but tend to be unsung heroes. They're not recognized. And we want to make sure that we continue to shine a light on all these extraordinary women that don't really get recognized. So again, we're very pleased to showcase these awardees tonight because they are a remarkable group. A very big thank you to all of our sponsors. Our presenting sponsor, Mass General Brigham.
Pfizer.
Innovara.
Locklord.
Point 32 Health.
Withers Worldwide.
Delta Dental of Massachusetts.
Highland Peaks Wealth Management.
Stat News and Boston Globe Media.
The Castle Group.
And Last Minute Productions.
We'd also like to thank the numerous endorsing organizations for their support in spreading the word about the nominations and the awards.
And a big thank you to our steering committee for their continued support and guidance. And now, on to the awards.
Let's learn all about these amazing, distinguished awardees who have both current and potential impact to advance healthcare, not only in Massachusetts, but around the world. Our first three awardees push the boundary of science and technology to advance innovation in biotechnology to the benefit of people all over the world. I'd like to thank Eileen Elliott of Pfizer for introducing these amazing heroes of healthcare.
Good evening, everyone. My name is Eileen Elliott, and I am Pfizer's site lead for our R&D hub here in Cambridge, Massachusetts. As a scientist working in biopharma for nearly 30 years, I've experienced firsthand the many critical contributions our exceptional women have made to the healthcare field. It is my privilege to introduce several of tonight's honorees. Please join me in congratulating Parastu Kaspilag, the CEO and co-founder of GC Therapeutics, a preclinical cell therapeutics company. Parastu is a scientific powerhouse. She has co-founded and co-invented 2 biotech companies and is the co-inventor for a core technology that is foundational for yet a 3rd biotech company. But some of her biggest contributions to healthcare come actually in the form of inspiring the next generation of women scientists. After completing her university studies and earning her master's degree in Iran, Parastu immigrated to the United States to continue her studies. She then continued her scientific career by completing a postdoctoral fellowship at Harvard University. Her continuing success as a woman of color, especially in this male-dominated field, is an inspiration to young women from all backgrounds who want to pursue and to grow their careers in the STEM field. In the words of her nominator, she is a kind, loving, and driven, fantastic role model for women who want to significantly improve patients' lives and want to lead their own business and be a leader in STEM. Congratulations, Parastu.
Hi, everyone. It is a great honor to be selected for the Extraordinary Women Advancing Healthcare in Massachusetts Award. I'd like to start out by thanking the Commonwealth Institute for everything they do for female leaders, and also the biotech community in Boston and healthcare community in Boston, and my colleagues and those who nominated me for this award, including Dr. Joanne Kamens. I would also like to thank my co-founders, Professor George Church and Dr. Alex. Well, this award is, of course, incredibly meaningful to me as a female entrepreneur and a member of Boston biotech community. Our company, GC Therapeutics, is focused on developing next-generation cell therapies for patients. And we've set up our organization to be incredibly diverse in gender, sexual orientation, and, of course, race. As of now, our company is about 50% female, and we are incredibly proud of that. And this is, of course, not something that happens often and frequently in biotech, and we're really active about this. When we started looking for talent, our message attracted many strong female scientists who were not only looking for an environment that they could excel in, but also a place that they can make a significant impact. While diversity also brings a new vision that is sometimes, unfortunately, missing in the field. For example, our team started thinking about the imbalance between male and female stem cells sources for us to actually perform our R&D and also build our technology based upon. And now we're actively considering a more diverse cell source. Well, our company was born during COVID, and in the last 18 months, like everyone else, we've been facing a lot of challenges. I'm really, really proud to be a part of the biotech community that is facing this challenge head on. I actually have learned during this period how incredibly resourceful and adaptive my team and everyone else in biotech has been. And I'm really proud to be a part of this whole journey. Our team has risen to the challenges of starting a new biotech, as you can imagine, biotech company during this unique period of time and period in history. We've also learned from the manufacturing challenges associated with scaling up complex medicines during this time. And our team is even now more determined in our mission to making therapeutics, and in our case, cell therapies, more accessible and easier to manufacture. I just want to say overall, it has been an honor to be a part of the biotech family. And I really believe the Commonwealth Institute has done an amazing job increasing visibility for women in healthcare in Massachusetts and in Boston. So I'm really thankful for that. And I really appreciate to be one of the awardees among all other wonderful awardees of this year. Thank you very much.
Sally Wang Leong is Vice President of Business Development and Head of the Global Business Unit at Peplib, a peptide drug discovery company with a novel screening platform. While Sally's academic and professional achievements are many, what stands out most is her commitment to supporting young talent and championing diversity, equity, and inclusion in her industry. As an active member of Women in the Enterprise of Science and Technology and Women in Bio, Sally continuously strives to create opportunities for female founders and to support and mentor young women in STEM, especially entrepreneurs. She also leads the gender diversity initiatives at Peplib, speaks regularly at leading universities on diversity-related topics, and has mentored the female CEO of a new preclinical biotech company. In the words of her nominator, Sally is dedicated to helping women in STEM and in the healthcare industry pursue their dreams and reach their fullest potential. Congratulations, Sally.
Thank you, the Commonwealth Institute, for this award. I'm so honored. It is incredible and deeply humbling to be among this group of extraordinarily talented and giving women. This award is special. We're at a time of rapid transformation, yet continuing gender disparity. The need to support each other is never greater. I started my career in pharmaceutical consulting during a time when firms were hiring equally, but partners were almost all men. My class at Harvard Law School was almost 50% women, yet 65 years after Harvard Law School started accepting women. Among its first female graduates was my hero, Justice Ginsburg, who I'm honoring by wearing her dissent collar today, and who inspires me every day to fight for the advancement of women. As a healthcare entrepreneur, I'm grateful for the support of many initiatives and mentors, men and women, promoting female founders. And finally, as a VC, I'm part of Breaking 7%, named for the 7% only of female partners and managing directors. The time to act is now. I applaud the Commonwealth Institute in establishing this award and the important work you have done to lift women up. So many women will be so grateful for your work. Thank you so much to my nominator, Arthur Hiller, for believing in me, to my husband for being the biggest supporter of my career, and finally to my parents, especially my mom, for being my very first strong female role model. Thank you so much for the award.
I am pleased to introduce Maria Palacios, President and CEO of Lyra Therapeutics, a biotech company researching ear, nose, and throat diseases. Beyond her company's success, which included an IPO in 2020, Maria is deeply committed to mentorship and ensuring diversity, inclusion, and equity throughout her professional sphere. Maria serves on the board of MedExec Women, helping to empower female executives around the world, and is a dedicated mentor to a first-time CEO. She regularly speaks on panels for organizations that promote opportunities for women in science and as business leaders. She has helped to ensure that diversity hiring is a priority at Lyra, exemplified by the 4 women on her leadership team. In the words of her nominator, Maria is both a top-notch chief executive officer and a known voice for advancing women in science and biotechnology. Congratulations, Maria.
Good evening. I'm honored to accept this Extraordinary Woman Advancing Healthcare Award, and I'm also delighted to be among a group of so many amazing and talented women. I would like to thank the Selection Committee and the Commonwealth Institute for hosting this award, which helps shine a light on female leaders and sets a strong example for other women who aspire to take on leadership positions. Empowering women executives in leadership roles in science and biotechnology is especially important to me. During my 2+ decades in this industry, I'm encouraged that progress has been made. However, women continue to be underrepresented in leadership roles in science, and we all need to step up our efforts to support, mentor, and advocate for women executives. I also feel strongly that companies and organizations need to show that they are committed to the upward mobility of women in the workplace. This includes providing challenging roles for women and allowing for flexible work schedules. At Lyra, we're proud that we have attracted and retained women at all levels, and more than half of our company leaders are female. An investment in diversity of all kinds is an investment in new sources of strength, problem solving, creativity, and innovation. These are the skills we need to continue the important work of advancing new treatments and services for patients. Together with my fellow honorees, I am proud to be leading an increasingly diverse workforce and making a positive impact on human health. Thank you.
Our next awardees created systemic change in the healthcare system and better connected underserved communities with access to the healthcare that they deserve and need. I'd like to now introduce Mass General Brigham, who will introduce the awardees in this category. Thank you.
As an alumna of Babson College and a member of the Mass General Brigham Senior Leadership Team, I'm so thrilled to introduce Dr. Claire Cecil Pierre. Dr. Pierre is Executive Director of the Carrie Murphy Healy Center for Global Healthcare Entrepreneurship at Babson College, as well as the Chief Medical Officer at Harbor Health Services. As a physician, Dr. Pierre inspires practitioners here and across the globe, focusing on combating inequality due to socioeconomic status. As the first executive director, she has begun inspiring the next generation of economic and health leaders to design solutions to increase access to health and provide economic mobility. Let me just read a quote from her nomination. Dr. Pierre grew up in Haiti, where she witnessed children her own age suffering from hunger and illness every day. She remembered wanting to become a doctor very early on so that she could help others. Her medical career has been exemplary, with the focus on combating inequalities in healthcare that exist due to socioeconomic status and where one lives. As a physician, she's inspired healthcare practitioners here and around the globe. In her newest role as the first executive director of the Carrie Murphy Healy Center for Global Healthcare Entrepreneurship, she has begun inspiring the next generation of people, leading our economies and health systems to design solutions that increase access to health and provide economic mobility. Her initiatives, whether responding to disasters and outbreaks in Africa or transitioning Massachusetts community health centers to telemedicine, are always innovative, always impactful, and she is an extraordinary woman advancing healthcare in Massachusetts.
It is truly an honor to be recognized along with this incredible group of women transforming healthcare in our region. I want to start by saying thank you to my colleagues at Babson College. I've learned so much about entrepreneurship from you. To my colleagues at Harbor Health, who work tirelessly to serve patients and elders through our community health centers and PACE program. Your commitment to serving everyone regardless of ability to pay, and your wraparound services to keep our elders safe at home are truly a source of inspiration. And to my colleagues at Harvard Medical School and its teaching hospitals, thank you for pushing me to strive for more. Raised in Haiti by a mother who really defied all odds to run programs that help those living in rural areas and carry their political voice beyond their geographic location, I was surrounded by a dad, sisters, cousins, and now loved ones and their children who helped me understand the true definition of love and the true meaning of purpose. This award belongs to the people who get turned away when they really need to see a specialist, but their insurance is not accepted. It belongs to the guardian who's responsible for so many living in a one-bedroom apartment with 6 people, trying to have a doctor's telehealth office visit with no privacy and with limited internet access. It belongs to the future entrepreneurs, policymakers, clinicians, administrators, philanthropists, and investors who will finally see what I see, which is that our medical assistants, our nurses' aides, our home care workers, our environmental services team members, our patients, our staff are experts ready to design and disrupt healthcare. So I hope to engage with you and many others as partners and allies in the efforts to invest in community health centers and community-based organizations as places that can host and manage incubators, accelerators, and more, so that we can ensure that the new tools being launched to deliver healthcare are deliberately designed with a health equity lens. That means including the skills, the talents, and the needs of people across socioeconomic status, across races and ethnicities, across genders, and across abilities. So with that, I'll end by saying thank you to TCI for creating this space for me and for these talented women who are all transforming healthcare so that our work can be recognized, but more importantly, so that we can learn from each other. I am ever grateful. Thank you.
Dr. Claire Wagner is the Chief of Staff to the CEO of the Bill and Melinda Gates Medical Research Institute, a nonprofit biotechnology organization that applies breakthrough science and technology to combat diseases that disproportionately affect underserved populations. Prior to this role, Dr. Wagner was a research fellow in Kigali, Rwanda, for several years before joining the Dana-Farber Cancer Institute and Union for International Cancer Control to advance a global cancer effort, resulting in the 2015 expansion of the World Health Organization's model lists of essential medicines for cancer. I'm told that Claire has had the same cartoon on her desk for a decade. It's a drawing of an airborne penguin looking down at his comrades on an iceberg with the caption, "We just haven't been flapping hard enough." Claire describes her approach to work in the same way. If we flapped harder, what can we achieve? If we keep our minds open, how far can we go together? Claire is an innovator and a mentor with a goal of spearheading change in the underserved regions of the world, and for that, she is an extraordinary woman advancing healthcare in Massachusetts.
Good evening. My name is Claire Wagner. I'm humbled to be here tonight to accept this award with such amazing women leaders, some of whom have personally inspired my own career. I'd like to start by thanking the Commonwealth Institute and the award committee for creating a space where women are recognized for the contributions they make here in Massachusetts. And a special thanks to Greg Stone for nominating me. Greg is a recognized leader in Boston who I've had the privilege of working with before and who personally invests his own time in advancing women leaders in healthcare. If there's anything that the COVID pandemic has taught me, it's that we need strong leadership, particularly in science and in healthcare. And as I look around this virtual room tonight, I see just that. I see leaders who have dedicated their careers to advancing science, to bettering public health, and to bringing innovation forward in this unsettling time. Today, our collective mission to drive public health has been amplified across everything that we do, not just in the office, but at home, at the grocery store, at our kids' schools, over FaceTime with family and with friends. It's quite literally become the compass for how many of us make decisions, how we think about leadership, how we engage in our communities, and frankly, how we approach global health broadly. I have the opportunity at the Bill and Melinda Gates Medical Research Institute to be part of the Cambridge community, an international hub of healthcare, biotech, and pharma that is a driving force in innovation and discovery, and one that impacts health and well-being across the globe. And now I have the opportunity to be part of this particular community, a movement of women leaders dedicated to accelerating impact in their respective fields, and to making a difference in the world. You know, when I was living in Rwanda, working for the Minister of Health, Dr. Agnes Binagwaho, she always used to say, global health is where you put your feet, meaning good work to improve public health happens everywhere. So my hope is that we continue to take forward the lessons that we've learned from the COVID pandemic so that the next generation of leaders can have an enduring impact wherever they put their feet. Once again, I am truly honored to receive this award, and I wish everybody a safe, happy, and healthy fall. Thank you.
Hello, I'm Dr. Elsie Taveras, Chief Community Health Equity Officer at Mass General Brigham. Mass General Brigham is pleased to be the presenting sponsor for the 2021 Extraordinary Women Advancing Healthcare Awards, and I'm especially pleased to be able to introduce our next honoree and my personal friend, Dr. Maisha Minter-Jordan, CEO and President of the CareQuest Institute for Oral Health. Maisha is a driving force across our Commonwealth to make healthcare more equitable, accessible, and integrated for everyone. As a physician, Dr. Minter-Jordan has seen firsthand the impacts of systemic racism and inequity on the health and well-being of historically underserved communities. She has dedicated her career to building a future where everyone can reach their full potential through optimal health. She truly is an extraordinary woman advancing healthcare in Massachusetts and incredibly well deserving of this award. Congratulations, Maisha.
Hello, everyone. My name is Dr. Maisha Minter-Jordan, and I'm the proud president and CEO of the CareQuest Institute for Oral Health. I'm honored today to receive the annual Extraordinary Women in Healthcare Award along with my distinguished colleagues. Thank you to the Commonwealth Institute for this incredible honor. And thank you to the CareQuest Institute and DentaQuest community for joining me in this journey to create a more accessible, equitable, and integrated healthcare system for everyone. Whether as a CEO, a physician, a colleague, or a friend, I feel strongly that my purpose must be rooted and connected in community. This is a powerful lesson that my mother taught me both in word and in practice. This award is a testament to my mother and all the other women in my life who raised me, mentored me, and encouraged me along my journey. I'm sure the Commonwealth Institute shares my sentiment when I say how lucky I am to have Pam Reeves as my board chair. She's an incredible partner and champion, and she empowers women leaders across our organizations. The past 18 months have challenged us all in ways most of us could never have imagined. But these challenges have driven me to find bold ways to use my power, my position, and the career that I have built to make a more meaningful impact. And as a female executive, I am committed to using my voice and power to pay it forward to other women, particularly within the healthcare space. Over the last several months, I've talked a lot about how the COVID-19 crisis has laid bare inequities that existed well before it ever began. And today I think it is critically important to shine a spotlight on the incredible burden this pandemic has placed on women. I am fortunate enough to have two beautiful teenage daughters who don't require childcare, and I'm able to run my organization remotely. But we know that the pandemic has created untenable circumstances for far too many women trying to manage a career, childcare, and the primary education of young children, as well as other responsibilities simultaneously and with little to no external support. Right now, women are leaving the workforce in record numbers, which is only further exacerbating long-standing wage and employment gaps. For women of color, this gap is even more significant. My message is simple. Now is the time to take immediate action to address the inequities that have plagued our communities for far too long. Women must have equal pay for equal work. Women must have access to health care that is equitable and accessible in order to keep themselves and their families healthy and strong. And women must be in corporate and nonprofit leadership in order to drive the meaningful change that we need. At CareQuest, I've challenged myself and my leadership team to tackle this head on through our talent approach and culture strategies as we build a more impactful organization. And today, I challenge all of us who are listening to use your voice and your power to lift up our women. Women are driving transformational change across this country, and I'm honored to do this work and to be part of a prestigious group of women being recognized today. Together, we can create change and build a more equitable healthcare system for all. Thank you.
Whether it's artificial intelligence and machine learning or other technologies, our next two leaders are harnessing innovation to create significant advances in patient treatment and biomedical discoveries. I'd like to turn it over now to Richard Emmons of Withers Worldwide to introduce these amazing women.
Hello, my name is Dr. Richard Emmons, and I'm a partner in the Life Sciences Group of the Business Division at Withers Worldwide, a proud sponsor of the 2021 Extraordinary Women Advancing Healthcare Awards. It is my great pleasure to introduce Dr. Brandy Davis-Dusenberry, Chief Scientific Officer at Seven Bridges Genomics, a leading biomedical data company focused on developing software and data analytics to drive both public and private healthcare research. Brandy's list of professional achievements is impressive. Motivated since childhood by a strong sense of curiosity, She earned a PhD in biochemistry from Tufts University and went on to complete 2 postdoctoral fellowships at Tufts University and Harvard University, respectively. Brandy then entered the private sector as a senior scientist at Seven Bridges. Over the past 7 years, she has worn many hats at the company, including that of program manager, senior vice president, CEO, and CSO, which is where she currently focuses her efforts. Brandy's team has lauded her as an amazing leader, manager, mentor, coach, and advocate. Brandy's colleagues have described her as being instrumental in developing revolutionary technologies that are paving the way for the company's ongoing success. Without further ado, it is my great pleasure to introduce Dr. Brandy Davis Dusenberry as a winner of this year's prestigious Extraordinary Women Advancing Healthcare Award. Congratulations.
Good afternoon. I'm deeply honored to receive the Extraordinary Women Advancing Healthcare Award and want to thank the selection committee and the Commonwealth Institute for considering me among this impressive group of women leaders. I also want to thank my colleagues at Seven Bridges for nominating me for this award. I feel incredibly lucky to work with a group of extremely smart, dedicated, and forward-thinking scientists, engineers, and business leaders. Lastly, I want to thank my husband, Alex, who's home now on parental leave with me, our 4-year-old, and our newborn. His support has been absolutely critical to allowing me to have such a fulfilling personal and professional life. Being selected for this award is particularly meaningful to me given the emphasis on mentorship. I've been fortunate to have many strong mentors throughout my career who've always encouraged me to push the boundaries of what I imagined possible. As I've advanced in my career, I've similarly worked to support my colleagues in their new endeavors. Further, at Seven Bridges, I've had the opportunity to do a significant amount of outreach and community engagement related to training young scientists how to use cloud computing to interrogate large-scale biomedical data sets. I firmly believe that data fluency is and will continue to be an absolutely critical skill for the next generation of healthcare practitioners and researchers. I find it incredibly rewarding to help build this skill set. Over the last 18 months, we've observed a staggering loss of women in the workforce across all sectors and levels of expertise. The demands of providing care for children, sick, or elderly relatives often fall to women, often at the expense of her career. As we look forward to reversing this trend as business leaders and citizens, we must create new ways of supporting all caregivers and encouraging more equitable distribution of these responsibilities. While it's a difficult challenge, I'm highly optimistic that the businesses in the Commonwealth are particularly well positioned to innovate the solutions to address them. Again, I'm honored to be considered among this year's class of Extraordinary Women Advancing Healthcare. I'm looking forward to the year ahead. Thank you.
I'm very pleased to have the opportunity to introduce Dr. Laura Kleiman, CEO of Reboot RX, a nonprofit technology startup dedicated to fast-tracking the development of affordable cancer treatments by using AI technology to identify non-cancer generic drugs for use in treating cancer. Laura has been passionate about both biology and mathematics since she was a child, and her educational background reflects this. She earned a PhD in computational and systems biology from MIT and was awarded 2 postdoctoral fellowships by the American Cancer Society to conduct research at both MGH and Harvard Medical School. Laura has focused her efforts on building holistic, cross-disciplinary collaborations that expand treatment options for cancer patients. Laura has been recognized with many awards from the 40 Under 40 in Cancer, the Massachusetts Next Generation Initiative, and the Dana-Farber Cancer Institute. In the true spirit of the Extraordinary Women Advancing Healthcare Award, nominator after nominator lauded Laura's commitment to mentoring and actively promoting their careers, as well as the careers of others. It is my great pleasure to introduce Dr. Laura Kleiman as a winner of this year's prestigious Extraordinary Women Advancing Healthcare Award. Congratulations.
Good evening. I'm so honored to receive this award. I'd like to thank my nominator and mentor, Andy Pollinger, who helps me be my best every day, Pradeep Mangaloth, Devin Crittenden, and the rest of the Reboot RX team, who I have the great privilege of working with, the patients and partners who support our work, and my family, who encourages me to persist when faced with challenges. I'm grateful to be recognized by such a prestigious organization as the Commonwealth Institute. Thank you to the steering committee for selecting me for this honor. At RebootRx, we're creating more treatment options for cancer patients who urgently need them, treatments that will be accessible and save lives around the world. To succeed in our mission of repurposing low-cost generic drugs, we'll need to realign incentives in our healthcare system to focus on maximizing patient outcomes instead of profits. We're starting to see this with the shift to value-based care, and I'm feeling hopeful. It's critical that more women hold positions of leadership in governments and boards of directors of corporations. We need to create more mentorship opportunities and lift each other up. This award is a great example of a program that increases visibility for women in healthcare. I've been so inspired by all of the honorees. Congratulations, and thank you for celebrating with us.
Our final awardees are physicians working on the front line to help ensure underserved communities get the proper access to the healthcare they need.
Hello, I'm Dr. Claire Levesque, Chief Medical Officer of the commercial business of Point 32 Health, the parent company of Tufts Health Plan and Harvard Pilgrim Healthcare. Point 32 Health recognizes the need for a focus on health equity, particularly in areas of current critical importance, such as vaccine hesitancy and reducing the stigma of mental illness. Therefore, it is a great pleasure to recognize these outstanding individuals and commend their career achievements. Please join me in congratulating Dr. Simone Wilds, an infectious disease physician at South Shore Hospital and clinical assistant professor of medicine in the Division of Geographic Medicine and Infectious Diseases at Tufts University School of Medicine. As a leader in her community, Dr. Wilds is addressing some of the most pressing health disparities facing the Black and Brown communities, ensuring everyone has access to important health interventions and equitable care. Her efforts, to name a few, include serving on Governor Baker's COVID-19 Vaccine Advisory Group and the Massachusetts Department of Health COVID-19 Health Advisory Group. She also effectively uses her role as health ministry leader at her church to connect with the Black and Brown community. At a time when COVID-19 has illuminated disparities in healthcare, the work of Dr. Wilds has been critical.
Good evening. My name is Simone Wiles. I am so grateful to Dr. David Rosman, the immediate past president of the Massachusetts Medical Society and the Massachusetts Medical Society community, for nominating me for this prestigious award. I am so grateful to be considered among this list of extraordinary women in Massachusetts. My goal is to use this platform to promote and encourage other women to use their voice in the healthcare sector to make a difference. If we stay silent, people suffer and die. The experiences from COVID-19 have highlighted the devastating impact of COVID on the community of colors. Racism is indeed a public health crisis as well. Many people are misinformed, afraid, hurting, and even dying due to the impact of COVID-19. We have so much work to do, and if we're serious about saving lives, this work has really just begun. We have strong women leaders who have been trailblazers in navigating this difficult path. Women have done it in the past, and we must continue this work. For us to make a difference, we must ensure that we move the needle even further and increase our intensity to ensure that things are done better today than the day before. We must continue to mentor and sponsor those behind us. We must widen the road for others to travel. In order to increase visibility, we need not only to be sitting at the table, but we need to have a vote in the decision-making process on key issues that impact the communities of colors, and we need to lead these discussions. We can no longer ignore the fact that racism, disparities, and racial biases exist. They need to be addressed. We need more diverse executive boards in the healthcare sector. I'm an advocate for more diversity in these spaces wherever I go. We as women, especially women of color, need to continue to ask the question, where is my seat at the table? And what is being done to develop leaders in these communities of color that have the foresight and the understanding of their communities and the vision to make a difference? My ultimate desire is to be a change agent for communities of color in preparing the next generation of leaders. Thank you.
Next, I would like to congratulate Dr. Juliana Chen, a child and adolescent psychiatrist at Mass General and Newton Wellesley Hospital and clinical instructor at Harvard Medical School. She serves as Associate Director of the MGH Center for Cross-Cultural Student Emotional Wellness and co-director of the Parents Program at the Resilience Project. Dr. Chen has conceptualized a novel approach to help reduce mental health stigmas through film. Her projects include Breaking Silences in the Model Minority, a national intervention to increase mental health awareness and decrease stigma in Asian immigrant families, and a short documentary, Looking for Luke, which has screened across the United States. With the pandemic exacerbating underlying mental health issues, her work is critical to support the emotional well-being of children and adolescents and their families. Thank you to every individual receiving awards tonight for their extraordinary contributions in our community and beyond.
Hello, everyone. I'm Dr. Juliana Chen. It is such a pleasure to be here as one of the recipients of the Extraordinary Women Advancing Healthcare Awards 2021, and especially to be honored alongside such an incredible group of women leaders. I'd like to thank my nominators, especially Dr. Cindy Liu at Brigham and Women's Hospital and Justin Chen at Massachusetts General Hospital, who've been such inspiring colleagues and collaborators throughout. Thank you, too, to my countless other teammates and colleagues without whom my work would not be possible. And of course, special thanks to the Commonwealth Institute and the Selection Committee for recognizing me and all of us here and the work that we do. It is truly an honor. It goes without saying the last year and a half has been a difficult one, and those working in the arena of mental health know this to be true. We work in a field that is often under-recognized, and this can be especially true for those of us working with underserved and minority populations. So this award is especially meaningful right now. While the last 18 months have likely tested us all in ways we could not have imagined, I've also seen firsthand the strength, commitment, creativity, and resilience in so many of my colleagues and neighbors, and in the patients and families I see. For those of us in the AAPI community, and really for all of us, it has been a painful but valuable reminder of the critical importance of sharing our stories and speaking out, and an important reminder of the power of connection and community. As we continue in our respective work to advance healthcare and increase visibility for other women, and as we face this next year and all that it may bring, I would like to encourage my fellow awardees and those watching, as you all do the incredible things you do day in and day out, wherever that may be, to please remember the importance of taking care and breaking the silence around mental health. Include and prioritize mental health and emotional wellness initiatives in the work that you do. Check in on those around you, especially the young, the elderly, those most in need or without a voice. And most importantly, please remember to take care of yourselves. As I continue my work advocating for children's mental health, decreasing mental health stigma, and supporting the AAPI community, I hope to do the same and want to thank everyone again for this tremendous award. Thank you.
So once again, congratulations. Cheers to all of our winners this year, and look forward to seeing you all next year. Thank you.